8 silent signs of fatty liver disease after age 55 you should never ignore. As we get older, our body goes through many changes. Some changes are easy to notice, while others happen silently inside our body. One of the most common health problems affecting adults over the age of 55 is fatty liver disease. Many people have it without knowing because the early stages often do not cause clear symptoms. Today, we will discuss the 8 silent warning signs of fatty liver disease that you should never ignore, especially after the age of 55, and we will also explore simple ways to protect your liver and improve your overall health. First, what exactly is fatty liver disease? Fatty liver disease, also known as hepatic steatosis, happens when too much fat builds up inside the liver cells. A healthy liver can contain a small amount of fat, but when the amount becomes excessive, it can affect how the liver works. The good news is that fatty liver disease can often be improved and even reversed when it is discovered early and when healthy lifestyle changes are made. However, if it is ignored for many years, it may progress to more serious conditions such as liver inflammation, liver scarring, cirrhosis, and other health complications. So, why does fat accumulate in the liver, especially as we get older? One of the main reasons is our diet. After the age of 55, our metabolism naturally becomes slower, meaning our body does not burn calories as efficiently as before. Eating too many processed foods, sugary drinks, sweets, fried foods, and unhealthy fats can place extra stress on the liver. Regular consumption of soda, packaged snacks, desserts, white bread, and other refined carbohydrates can increase fat storage in the liver. Another factor is excessive consumption of unhealthy oils. Some vegetable oils that are high in omega-6 fatty acids, such as sunflower oil, palm oil, and some processed margarines, may contribute to inflammation when consumed in large amounts. A lack of physical activity is also a major cause. Many people become less active after retirement or because of joint problems, spending more time sitting and moving less. When the body does not burn enough calories, excess fat can accumulate, including inside the liver. Insulin resistance is another important factor. This condition happens when the body becomes less sensitive to insulin, the hormone responsible for controlling blood sugar. Insulin resistance is strongly connected with obesity, type 2 diabetes, increased belly fat, and fatty liver disease. Genetics can also influence your risk. Some people are more likely to develop fatty liver disease because of their family history. Alcohol consumption is another important factor. Drinking large amounts of alcohol over a long period can damage liver cells and lead to alcoholic fatty liver disease. Now that we understand some of the main causes, let's talk about the warning signs. Fatty liver disease is often called a silent disease because many people do not notice symptoms in the beginning. But as the condition progresses, the body may start sending signals. The first warning sign is spider veins on the skin. Spider veins are small web-like red veins that can appear on the face, chest, or arms. They can sometimes be linked to changes in liver function. The liver plays an important role in regulating blood circulation and hormones. When the liver is under stress, changes in blood vessels may become visible on the skin. If you notice new or increasing spider veins along with other symptoms, it is important to discuss them with a healthcare professional. The second sign is red palms. Persistent redness in the palms of your hands can sometimes be associated with liver problems. When liver function changes, blood vessels in the hands may become wider, creating a reddish appearance. Red palms do not always mean you have liver disease, but if this change continues for a long time, it is worth checking. The third sign is a swollen abdomen. A larger belly does not always mean liver disease, but unusual abdominal swelling can sometimes happen because of fluid accumulation. This condition is called ascites. As liver disease becomes more advanced, the liver may have difficulty controlling fluid balance in the body, which can lead to swelling, discomfort, and a feeling of heaviness in the abdomen. The fourth sign is enlarged blood vessels in the abdomen. When the liver is damaged, blood flow through the liver can become restricted. This can increase pressure in certain blood vessels and cause enlarged veins called varices. These veins can become fragile and may create serious health risks. The fifth sign is persistent itchy skin. Many older adults experience dry skin, but constant itching without a clear reason should not always be ignored. The liver helps remove waste products from the body. When liver function is affected, certain substances may build up and cause irritation and itching. If itching continues for several weeks, it is better to consult a doctor. The sixth sign is pain around the right shoulder or upper back. The liver is located under the right side of the rib cage. When it becomes enlarged or inflamed, some people may experience discomfort that spreads to the right shoulder blade or upper back. This pain can have many causes, but unexplained and persistent discomfort in this area deserves medical attention. The seventh sign is dark patches on the skin. Dark, thickened patches of skin, especially around the neck, armpits, or skin folds, may be linked to insulin resistance. This condition is called acanthosis nigricans. Because insulin resistance is closely connected with fatty liver disease, these skin changes may be a sign that your body is having difficulty controlling blood sugar. The eighth sign is changes in the nails. Your nails can sometimes provide clues about your internal health. Changes such as unusual whitening, discoloration, or other changes in nail appearance may be connected with nutritional problems or certain health conditions, including liver problems. Now that we know the warning signs, let's look at 5 simple ways to improve liver health after the age of 55. The first step is choosing healthier foods. Your liver needs proper nutrition to work efficiently. Try to include more vegetables, fruits, whole grains, fish, eggs, and lean proteins in your diet. At the same time, reduce processed foods, sugary drinks, excessive sweets, fried foods, and large amounts of refined carbohydrates. The second step is staying hydrated. Water helps your body with digestion and waste removal. Drink enough water every day unless your doctor has advised you to limit fluids. Green tea can also be a good choice because it contains antioxidants that may support liver health. The third step is regular physical activity. Exercise is one of the best ways to protect your liver. You do not need intense workouts. Walking every day, light strength exercises, swimming, or gentle stretching can make a big difference. Regular movement helps burn fat, improve insulin sensitivity, and reduce fat stored in the liver. The fourth step is reducing alcohol consumption. The liver has an amazing ability to repair itself when it is given the opportunity. Reducing or avoiding alcohol can help decrease stress on your liver and protect its function. The fifth step is supporting your liver with healthy choices. Foods such as garlic, turmeric, leafy green vegetables, and beets can be part of a healthy diet. Some supplements are also promoted for liver support, but you should always speak with your healthcare provider before taking any supplement, especially if you are taking medications. Remember, fatty liver disease is common after the age of 55, but it is not something you should simply accept as a normal part of aging. By recognizing the warning signs early and making simple lifestyle changes, you can protect your liver and improve your quality of life. Your liver works every single day to keep your body healthy. Give it the care it deserves. If you found this information useful, share it with someone you love, especially family members over the age of 55. Take care of your liver, take care of your health, and remember that a healthier liver can help you enjoy a healthier life.